Good afternoon. It's Wednesday, March 20th, 2024, and this is a Protect Our Province live briefing on long COVID in children. I am Dr. Susan Coe, a family physician who's been working in Richmond, BC for 31 years. I'm a clinical associate professor at UBC and a member of Protect Our Province BC. Protect Our Province BC is a nonprofit grassroots organization consisting of doctors, nurses, health scientists, and community advocates striving to keep the people of British Columbia safe by sharing accurate information about COVID-19. We also advocate for the BC government to do more to protect the health and prevent chronic disease and disability for everyone who calls BC home, starting with the most vulnerable among us. We begin by respectfully acknowledging that we are broadcasting from the traditional, ancestral, and unceded territory of the Coast Salish peoples, specifically the Musqueam, Squamish, and Tsleil-Waututh nations. We are grateful to the Indigenous peoples who have cared for these lands since time immemorial. As settlers, we commit to do our utmost to uphold the Truth and Reconciliation Commission and work towards the 94 calls to action. Today, we are joined for a live briefing on long COVID in children by Dr. Abigail Chase. Dr. Case is a pediatric rehabilitation physician in the Division of Rehabilitation at Children's Hospital of Philadelphia. She is an assistant professor of clinical pediatrics at the University of Pennsylvania, program director of Pediatric Rehabilitation Medicine Fellowship, and the Quality and Patient Safety Champion of the Division of Rehabilitation at CHOP. She began working with an NIH-funded recovery initiative as a subject matter expert in rehabilitation in January 2022. RECOVER, which stands for Researching COVID to Enhance Recovery, brings together clinicians, scientists, caregivers, patients, and community members to understand, treat, and prevent long COVID. Since joining RECOVER, Dr. Case has helped on a number of different projects working towards understanding the definition and characterization of post-COVID conditions, also known as long COVID, in children and adolescents and how this affects overall function. She's a co-author of the comprehensive scientific review article on post-acute sequelae of SARS-CoV-2 in children, published in the March 2024 issue of Pediatrics. Dr. Case, we're so honored to have you join us today.
Hi, thanks, Dr. Coe. It's so great to be here and excited to talk more about this with you.
Just to give you some background, in Canada, there has been some data on long COVID in adults, including the December 2023 Statistics Canada report, which found that 1 in 9 Canadian adults develop long COVID after COVID infection. But when it comes to long COVID in children, there's been very little reliable data. This is why we're so happy to have you with us today to shed some light on this topic. We have so many questions for you, so shall we get started?
Sure.
So, how do you define long COVID in children?
Thanks. I wanted to just say briefly, I do work at Children's Hospital of Philadelphia and have participated in the Recover study, but my comments today are my own beliefs that I've gathered through these projects. And the question of how to define long COVID in children is a good one. I think the most important thing to emphasize is that long COVID or post COVID conditions is not one disease process, but really manifestations of several diseases and can be de novo conditions as well.
Is there a better term we should be using in children?
The scientific community has tried to adapt the term PASC or post acute sequelae of SARS CoV 2 to try to encompass the um, the broad spectrum of illness that can occur. I personally like the term post-COVID condition because I think it links directly to the acute event, and it also summarizes that it's a condition. One, it could be a transient state that the body is in, and it can also be a condition that looks different in different patient populations.
How is long COVID in children different from long COVID in adults?
Long COVID in children is different than adults in a lot of different ways. Mostly that the population is different. So, pediatric patients, children, adolescents are in a dynamic state of development and also have varying degrees of ability to express and to express themselves. So, as an example, in an adult patient who has a headache, they're able to express that pretty clearly. If you were taking care of an infant or a young adult, I'm sorry, a young child, under school age, they may not be able to express to you what they're feeling. And so their symptoms are going to look different. In addition to being a different patient population that we have to take into context development, they also have an immature developing immune system.
Mm-hmm.
And we've experienced that difference initially early on with the phenomena of multi system inflammatory syndrome in children, or MISC.
Mm-hmm.
That didn't occur in adults, but did in pediatric patients, although it was rare. Um, and we there's a lot of thought on how, what the underlying pathophysiology of that process is in terms of immune dysregulation that we have also
Mm-hmm.
seen in different ways of adults, but it looks differently. So it looks different because it is different, and it's hard to define because it's heterogeneous, and it takes into context the development ability and stage of growth that pediatric patients are in.
Oh, thank you very much. Now, how do children with long COVID present at your clinic?
So, um, as a pediatric rehab physician, we're a small field, but we're versatile. We participate in the care of patients in outpatient clinics as well as inpatient. And so, primarily for me, initially, I was seeing patients that would come into the hospital um, with severe illness, and it didn't
Mm,
doesn't always have to be related to SARS-CoV-2, but sometimes it was. And so that was my first exposure to patients that I would say had a post COVID condition affecting their function. In addition, there was a post COVID or a long COVID clinic here at Children's Hospital housed in the pulmonology department. And that is a product, I
mm,
think, because most symptoms um, initially were related to respiratory with cough and shortness of breath. So that was
mhm,
a natural home for these patients to present. And their symptoms were related to mostly fatigue. And so, and inability to participate in, sports that they maybe were previously easy to do for them. And so we had a physical therapy team that came down and participated in that clinic. But now most of my exposure and understanding of pediatric long COVID has come from participating in the Recover initiative, which it uses data from PedsNet, and that leverages over 100 hospital systems across the country. So uh, my anecdotal experiences with patients is small now in comparison to what I've been reviewing and exposed to through that network.
yeah, the work that you're doing there is really important. We're happy you're doing that. Um, so, what symptoms should parents look out for? They're concerned their children may have long COVID.
That's a great question. I think as a parent, it's really important to think about, and parents know their children best, but think about what underlying conditions your child might have. So as an example, if your child has eczema or asthma,
Mhm.
just being aware of how that condition's been maintained. If you're requiring extra medications or an inhaler more often, that might be something that you want to talk to your medical team about and discuss,
Mm,
because I think more often than not, these post COVID conditions can express themselves as an exacerbation of a pre existing or underlying condition. In addition, it's important to stay on top of if your child has had
yeah.
a recent illness and that the symptoms are persisting and seem to hang around for longer than is typical. And we know viral illnesses in certain times of the year are pretty common, and can take time to recover, but we're talking longer than 4 weeks,
Mhm.
and persistent. And then, new symptoms too would be important. So new symptoms that aren't associated with other bouts of infection. So, um, to kind of summarize that, most common symptoms in patients and adolescents are still fatigue, um, general malaise, the constitutional symptoms. So, just generally feeling not like themselves, and then it can affect almost any system of the body, and it's different for different patients. But mostly just staying on top of if there are changes in your child after 4 weeks of having infection.
Yeah, thank you for those calls. I definitely in family medicine we've been seeing many children with these symptoms. So, now, how do you diagnose long COVID in children?
The diagnosis of long COVID has been a topic of discussion for the past several years. There's been conversations that, you know, does do you need a positive test to diagnose COVID, long COVID? And I think initially, when testing was more robust and
Mm-hmm.
you know infections weren't as common, that made sense. But as we've transitioned and this has evolved, the line of thinking is that you don't really need to have had a test to positive test in the past 4 weeks to diagnose long COVID, and that also goes back to a large percentage of infection can actually be asymptomatic. And so I think to diagnose long COVID, it it is good to know if you've had an acute infection, because then your index of suspicion is going to be higher and you can be thinking about it and having it on your differential for new symptoms or persistent symptoms, but it's not required. And so in order to diagnose, it's really taking a step back, looking at the symptoms, looking at the context, if a patient's been recently ill, and trying to rule out other common causes for conditions. Maybe there's some diagnostic workup that happens,
Mm-hmm.
and there also may be some period of time where you trial some treatments to see if it can be therapeutic and diagnostic.
Mm-hmm.
But when symptoms persist despite the typical workup or the typical um, troubleshooting that might go on between a child and their physician or medical team, then you start to wonder if it could be related to potentially a persistent infection, um, or a post COVID condition. And I think the other thing I want to say here that's important is that context. So if there's high viral activity in the community, um, that might be a clue to you to have that higher on your differential and really be having that conversation earlier on, rather than waiting months and months before you're make that diagnosis.
Yeah, so in other words, summarize what you're saying, it's really based on a clinical diagnosis. There's not really any tests right now available.
Yeah, that is a challenge, but there are a lot of things in medicine that end up ultimately being a clinical diagnosis, and um, I would say I hope that potentially we have better testing in the future, but I don't know that there'll ever be one test that can really encompass the broad nature of this, of the post-COVID conditions.
Yeah, and that's definitely what we've been finding here as well. Um, so in BC, long COVID is being minimized or even disregarded by many healthcare providers. Is this also happening in the US?
Yes, that's a hard one. I think what I can say for sure is that there's definitely been missed opportunities for diagnosis based on the chart review work and some of the discussions that we're having in our national group. And I think as far as minimizing, I would look at it as really a knowledge gap. And that goes back to not only with medical teams that are on the front line or are seeing patients, as the first end, but also as the research community, because we've had um, it's been a challenge for our community as well, and that goes back to um, not being able to easily identify who's had a recent infection, who hasn't, um,
Mhm.
and again the dynamic state of being in pediatrics. So I would say that's definitely happening here, and I don't even I would caution saying people are minimizing. I think there's just a lack of awareness, and with that lack of awareness comes um, misdiagnosis or not having it on our differential or our radar.
Yeah, that's very interesting. Uh, Thank you very much for that comment. Now, do we know how many children in the US are currently dealing with long COVID?
So in the United States, our we're really working on an estimate because we don't have a national database of um, infections anymore, and they're not being tracked. But and you probably have seen if you were looking at the post-acute sequelae review that we published. But our estimate initially was based off of a couple small single population review articles where it ranged from 2 to approximately 60% of patients that have had an infection go on to have a post-COVID condition.
Mm,
And with more articles coming out, we can feel more confident in saying that it's closer to 10 to 20% of patients who have an acute infection go on to have some sort of post-COVID condition. And with that in mind, looking at the estimate of current infections, that would encompass close to 5 million children. Um,
yes.
and I think that that obviously is a significant public health impact. But I
Mhm.
think, again, we have to put this into perspective that it is a spectrum. And so some of the post COVID conditions may be mild, and then some may be more significant, more severe. So that's total number, including the mild. And in that same line of thinking, um, patients do recover and so may have had a post-COVID condition that was transient and now have gone on to be recovered.
Do you have any idea how many worldwide you think there is in terms of long COVID in children?
I I think that's a really challenging question, and I wouldn't even be able to gauge some of the um, estimates that I keep up with. Have in terms of just infection, we know is not being reported. So it's hard to gauge if you don't know the number of current infections. It's hard to gauge who's having a post COVID condition, especially in the global environment where um, resources have always been more limited in other area in certain parts of the world.
Yeah, but the number you gave, the 5 million, that is such an astounding number. And that's the current day. We don't even know what's going to happen in the future, right? How many down the road we're going to see. So,
I think
yeah,
it's a sobering number, and I think also um, it's hard to assuage that number with the lack of um, diagnoses that we're seeing commonly given to children. So it's definitely a knowledge gap.
yeah. I think there was a Nature article last year, and they said that the amount of long COVID in the future is unfathomable, according to the authors. So, yeah, it is very sobering thought. Now, of the children that you're seeing, what percentage are being severely impacted by the long COVID?
So fortunately, it does seem to be that it's a small number that, and to define severe, I'm thinking of hospitalization, major functional changes. So being working at a large academic institution where we see lots of children, I have in my practice a significant portion of patients that I follow that have had um, a severe impact. But I would say overall that number actually is quite small. But when it is
Mm.
significant, it's pretty severe, and it's worth noting and studying and researching. So a small, less than 1%, small number.
Now, what role do repeated infections play in the development of long COVID in children?
That's a great question. The current understanding that I have is with each infection, you run the same 10 to 20% of um, risk of developing a post COVID condition. And that number doesn't necessarily change based on whether it's your first, second, or third infection. So you're not necessarily more at risk based on your infection, but just as a statistic, number wise, you if you have more infections, you have more opportunities to develop a post-COVID condition. And that might change as we learn more. I think I like to always remind people that this is a novel disease, and some of our best longitudinal studies really haven't even gone further than 12 months. So again, we may be having this conversation again, and that might change.
Yes, it reminds me of an article recently on the 1918 flu pandemic and how the effects of that were not sometimes seen until 60 years later when we looked at the data, right?
Yeah. It,
And now, as a children's rehabilitation physician, what impact do you see long COVID having on children and their families?
that's a great question. So, as a pediatric rehab physician, I'm always focused on function. I part of what I love so much about my field is that we get to interact and see patients of all different abilities and different disease processes, and it doesn't always necessarily matter why a patient may be having a functional decline when we're talking about function. And so, in general, the impact I've seen has been significant. I think the biggest thing I worry about in my assessment, so we I think about mobility and communication, and then we have this term we use like daily activities, or and for adults that's return to work, and for children and adolescents that's return to school. And so in adults, we have seen uh, a number or percentage of adults that have had difficulty returning to work. And so my concern has really been trying to focus on children's ability to return to school, and I have seen that impacted by a post-COVID condition. And I think that when we're able to better gleam on a large number, this impact is going to be even more challenging. And I think um, because we've seen that in adults, that's why rehabilitation medicine has been pivotal and included in the Recover study. And so, to answer your question, the impact is certainly there. We've certainly seen children that have had difficulty returning to school or their sports. I've seen high level honor students who have gone on to have to drop out of their higher level courses, and that's been hard to watch. But in addition to that, I think we're going to see it on a larger scale when we're able to kind of connect these dots a little bit more.
Thank you very much for that. And in your experience, what improvements can children with long COVID and their families hope to see?
Um, yeah, I mean, I think the improvements that are kind of going to go in order here are, I would hope to see improvement in prevention, meaning that we find creative ways to prevent infection, because that's the only way to 100% ensure that you're not going to develop a long COVID infection. That's hard when there's a lot of viral activity, and of course, we all know that getting into school and all of the things that are involved in community life are important too. So I would say improvements in prevention, understanding who's at risk, understanding how things like vaccination can improve preventive strategies, understanding better how air quality or improving air quality can be leveraged. I think that's an underutilized tool. And again, it's not my area of expertise, but I do think that that's something that we can look forward to. And then in addition, better diagnosis. So hopefully, as we continue to learn in the scientific community, we're able to educate and share information with the medical teams and clinical folks who are seeing children. And then treatments. And I think that's harder because, as I've probably said many times now, it's not one condition. And so the treatment's going to be a little bit different for everyone. But that goes into better research and understanding of the pathophysiology of um, post COVID conditions. So if it's persistent viral activity, we're going to utilize antivirals. If it's potentially related to clotting or microclots, we may be looking into different blood thinners. And so understanding why a patient's experiencing the symptoms they are and what subphenotype they have of post-COVID condition is going to dictate treatment. And that's why it's taking some time. But I think in the future, we can look forward to that as well.
I totally agree. That was really well said. Thank you. Um, so, what are some of the current treatments available for children with long COVID?
In my experience right now, most of the treatment is related to symptom management and supportive care during acute infection. So when a patient has an acute SARS-CoV-2 infection, it's important to provide adequate hydration to reduce, uh, you know, clotting or at least the risk of things like clotting, and as well as getting rest and allowing the body to heal. So that sounds fairly basic because for a long time we've known that treatment for viral illness is often supportive, but I think it just to highlight that is one of the things that we're educating and hoping to express to families who are dealing with long COVID. And then, um, at least in the adult recover arm, so the recover study has a pediatric arm and an adult arm. They're looking at things like antivirals, and in addition, they're looking at like how using antivirals in the acute phase and or post acute phase can prevent and or treat um, long COVID symptoms. So it's
Mm,
right now very early on, and I would say for
hmm.
pediatric patients, there aren't many evidence-based treatments that I could recommend other than the supportive care, but I hope that that would change when we learn a little bit more.
That sounds exciting, very promising. Um, so, when children do receive some of these treatments, over what time period do you see improvements?
So, in general, children who have had symptoms consistent with a post-COVID condition, um, more off so up to two-thirds of patients recover in that first 3 to 6 month time frame, sometimes even sooner. And then approximately one-third of children go on to continue to have symptoms um, around the 12-month mark. And that's where we're still learning because some of these longitudinal studies are really now just hitting the 1 year mark.
Hmm. So, we've talked a bit about the NIH Recovery Program, but can you tell our listeners a bit more about what that's about?
Yeah. So, the NIH Recover Initiative, or Enhancing the Road to Recovery, researching COVID to enhance the road to recovery is important. Um, in There's four major aims that we have, and one is to really focus on prevention. Um, the second is to focus on understanding the mechanisms and the subphenotypes and clinical characteristics of long COVID or post COVID conditions in both adults and pediatric patients. Um, Third is that we want to share this information broadly and to publish this so it's available for clinicians and medical teams taking care of these patients. And fourth
Hmm.
is to ultimately provide treatments um, and to provide right now trials to have high quality large studies that will allow us to say with more confidence what's going to help patients that are having persistent symptoms.
Yeah, it sounds like a wonderful program. I hope it can continue. Um, so, as a parent, what can parents do to prevent their children developing long COVID?
I, that's a good question. I mean, it's some of this it comes from in my opinion what I'm seeing, and then some of it is just um, the anecdotal piece that I've learned from listening to other work groups and patients. But I think the most important thing is to try to prevent an infection if possible. And that's hard because we know that SARS-CoV-2 is very contagious, um, that prevention measures have rolled back as we've engaged with learning to live with SARS-CoV-2. And so I think preventing infection comes down to, like I've said in the past, potentially the air quality and indoor airspace, making decisions related to community viral activity and risk. So we know that. Patients that are immunocompromised are at higher risk, and then masking when we
Mm.
think that the risk of infection is higher. I would say when and if a patient gets an acute SARS-CoV-2 infection, um, that you test and that you're aware of that, so that you can monitor your child for persistent or ongoing new symptoms, and also vaccinate. So there was a recent study just published looking at the effects of vaccination on long COVID in children, and it's certainly a difficult topic. There were um, a difficult topic to study for a lot of reasons, and I can get into that more. But what I want to say is that it definitely, similar to adults, showed that vaccinating reduces the risk of serious infection. And then there
Hmm.
were also signals to suggest that there was less healthcare utilization in children that were vaccinated after. And so that really is going to take a little bit more research, but certainly there are suggestions that it could prevent and lessen the symptoms of long COVID.
That was really well said, and I totally could not agree with you more. Um, Now, is there anything more you'd like to share with us that we haven't covered already today?
Well, I just wanted to thank you for having me on this today and getting the opportunity to speak with you. This has been an important topic for so many patients, and really trying to get to the bottom of this has been difficult. And I think just having the conversation, iterating what we know, and continuing to learn more is going to be our best opportunity to help patients that are having long COVID.
Yeah, I totally agree. We need to get the information out to everyone, to the public, to healthcare workers. So, but we would really like to thank you very much for coming on today. That's wonderful.
Great. Thanks so much for having me. I am currently working on a manuscript looking at functional outcomes for patients that have past or long COVID. So please look forward to that being published shortly.
We look forward to reading that. I think now we actually have some questions from some listeners. Oh, is CHOP Long COVID Clinic in Philadelphia still open?
Um, so it is technically still open, but there have not been many patients coming through. And I think that goes back to, it was never a comprehensive long COVID clinic. It was really long COVID defined by persistent cough and persistent shortness of breath. But we know now that there are many other symptoms that you can have. And so we don't have a clinic that specifically sees patients with long COVID right now.
So it's from Rena Abraham Harrington. There are articles suggesting dysfunction at the mitochondrial level underpinning development of long COVID. Are you finding any similarities between your mito patients and long COVID patients?
That's a great question. When you say mito patients, I don't want to assume, but I think hopefully you're talking about patients that have like mitochondrial disease related to like a genetic mutation and maternal DNA, and those patients, um, I think, have pretty specific complications like seizure disorder and functional decline, neurodegeneration that I'm not necessarily seeing in long COVID patients. Um, but maybe I'm not sure if I'm understanding that question entirely, but um, I haven't quite put those two together, not to say that there isn't a connection.
The World Health Organization uses 90 days or more post infection for their adult definition of long COVID. Is the same delay used for children?
So for our research purposes and diagnostic we use 4 weeks, and that's based on the NIH. The NIH definition of PASC or long COVID has always claimed to be iterative, and knowing that it might change, but we really felt like 4 weeks is the sweet spot where you're not encapsulating acute symptoms, but you're also not missing patients that may have more mild post COVID. And I guess just one example of a post COVID condition is the MISC that I spoke of earlier, and that really happens in the 2 to 6 weeks after infection. So I think knowing that that was a phenomena in children and that we're really focusing on children, that 4 weeks felt like a better length of time to look at.
How does the presentation of long COVID in children vary based on age at onset or based on gender?
So, age of onset is one of the challenges that we've been facing in looking at this information. But when we talk about long COVID in adolescence. So I'll start with adolescence because that's easy. I shouldn't say easy. It's a better defined population, and it looks pretty similar to like the young adult population that we've seen. In fact, a lot of the patients that came through the long COVID clinic here at CHOP were adolescents, and so they present with fatigue, shortness of breath, headache, brain fog, body aches, weakness, um, persistent fevers, rash, things of that nature. And then when you look at the school age, um, it's a little bit harder to define. Um, Patients aren't as good at expressing what they're feeling. So it might look like, um, constipation might be worse and you think about like GI symptoms. We see a lot, we've seen a signal for that. We've seen a signal for some of the symptoms that don't require description. So like GI symptoms are pretty evident and parents can express them. Um, you know, Persistent cough and pulmonology type symptoms can come, um, but the brain fog is where I've been doing a lot of thinking and research, and that's harder because it might present as difficulty in school or refusal to go to school. And then we have had a long conversation recently on, do we need to focus on neurodevelopmental? And that means those young infants and preschool age children, and looking at their development. Are they having delays? And is that related to potentially a post COVID condition? Because they may not be able to express, and we may not be able to ascertain some of the more refined symptoms. It might be one of the things and one of the ways post COVID conditions could express. And that, again, is going to require more research. So I can't say today with certainty that that's what's happening, but there have been studies to suggest that um, children who have either been born to mothers that had an acute SARS-CoV-2 infection or had SARS-CoV-2 during pregnancy or had it in early infancy are having developmental delay.
Thank you very much. This is from Kelly Salmald. Can you speak to increased incidence of diabetes in children post COVID and additionally blood disorders?
So I'm going to address the diabetic question first. So, and there were what was a study that I helped worked on with an EHR cohort that showed that children um, and this was looking at children that already had been diagnosed with type 1 diabetes, had worsening of their blood sugar control following a post acute infection. Um, and then more recently, there was a study that came out, and I'm not going to be able to tell you the name, but maybe in the show notes or later we could get that for you, where it did show that there was a slight increased risk of type 1 diabetes after an acute SARS-CoV-2 infection. And so I think um, that incidence overall was not huge, but it was clinically significant and important to note. And we've always known that viral infections can be antecedents or the inciting event for a type 1 diabetic to present, but SARS-CoV-2 had a clinically significant bump in that. And then blood disorders. So, in terms of um, blood disorders, I think clotting disorders is the one. Well, actually, there are a couple of signals: clotting disorders and also um, thrombocytopenia or increased platelets that have led to potential bleeding. And then we have seen a small incidence of um, uh, cerebral sinus venous thrombosis or CVST, and that is a but serious side effects, rare but serious post-COVID condition that we're not seeing all that regularly, but we have seen.
There have been concerns about more preschool children having language delays. How much is this due to COVID infections? And is language delay one of the neuro delays you mentioned?
Um, that's a great question of what is the connection between a COVID infection and a delay? And I think there's nothing yet to be able to say that children that have SARS-CoV-2 are having language delays, but or that is a clear linked cause. But what has happened in since 2020 has been an increase in delays. And so that question is really needing we need more information to know, is it related to the environment? I know as a rehab medicine physician, a lot of my patients get therapies regularly for delay and or deficits, and that
Mhm.
was all paused during the early stages of the pandemic, and then we had a time period where we were really trying to help kids catch up. But I would say that was a brief time period where therapies were delayed in the spectrum of this 4-year process now. So I would not comfortably say that the delay was related to pause in therapy now that we're 4 years out, because some of those children weren't even alive when that pause happened, but I think it certainly did contribute there in the beginning.
How are schools accommodating children with long COVID?
Um, I'm smiling because this is a question that I've brought up in some of our research groups. And so, one of the larger chart review studies that we're doing, I added this question to the data mining to say, are kids coming out? So, here in the United States, we have for accommodations, we have a 504 plan or an IEP. And I'm not sure if that's the same in BC, but you know, this is one of the functional outcomes that I was talking about to look out for. And I can just say that we actually weren't picking up on a lot of changes. And I think, but we were picking up on um, children that have had past had more increased missing of school, more referrals to physical therapy, more referrals to neuropsychology, but not an increase in 504 IEP. So I actually think it's just it's not that they don't need accommodations, but it's not necessarily happening. It goes back to that knowledge gap of um, if we don't know enough about long COVID and we're not diagnosing it early enough, then children aren't necessarily getting the accommodations they might need.
Are you seeing some families with more than one member with long COVID?
That's a great question. I don't have a lot of insight on that. That's not something that I've seen, but it not to say that it's not happening.
How common is POTS in younger children with long COVID, or is it more common in adolescents?
Um, so, i- as it stands in terms of reviewing the information, it's more common in adolescence. What I will say is that, again, to be able to describe POTS and what's happening is sometimes hard for even adults to do. So I don't know if potentially younger younger children are having symptoms of POTS, and maybe aren't quite able to express. They might just not want to stand up or not participate or be fussy, versus an adolescent or school age children that can tell you I feel dizzy or my heart feels like it's racing. That's a complex thing for a young child to be able to describe. Of course, it is diagnosed by heart rate, so it could be tested for with some of the testing, but I don't think it's being done commonly. And again, that testing is usually prompted by the description or the symptoms. And so if it's not being expressed, it may not be something that's tested for.
Thank you. How can we make the public and healthcare professionals more aware of long COVID in children?
I think we need to do, um, well, hopefully discussions like we're having today, but also continuing to ask the good research questions. So some of these questions that are coming through today are great research questions, right? And so being able to have funding to ask the questions, being able to coordinate. And so when I say coordinate, I mean you really need the numbers and the volume of patients to add power to your studies. So that's why something that the Recover Initiative has been doing is leveraging those connections or infrastructure that have already been established in the United States. So PedsNet and PreCordNet have already had established data sharing, and so that has led to a wealth of volume, which has allowed us to ask questions and look into it from a scientific lens. And so I think the more we can do that, ask good questions, the more we can publish this and have discussions at the national level, at national meetings. In the United States, we have something called CME or medical updates for physicians, and so being able to share good evidence-backed information that's going to allow pediatricians or family medicine physicians um, to recognize this, and I think that's going to lead to more knowledge about it.
Thank you very much. I think that was the last of our questions, but once again, I'd like to thank you so much for coming on today, Dr. Case. Your questions, the answers were just wonderful, and we were just so excited to have you with us today.
Great. Thanks so much for this opportunity.
And we'd like to thank our listeners for joining us today, and to our IT person, Carrie. We could not do this without her. And to thank you again, all the listeners, and stay tuned for our next live briefing.